All right, let's hope this is working. Regenerative is the alternative, trusted alternative for orthopedic surgery. And in this webinar, I'm going to show you our three-step process where we get these cells, how they work, what they can help, and then I'll answer all your questions at the end. I'm Dr. Paul Lieber. I'm a physical medicine rehabilitation trained, board certified doctor who's been specializing in regenerative medicine since 1998. On the one side, you can see me as Clark Kent. On the other side, of course, is my cycling Superman suit. And it's important to know that I'm no youngster. I'm almost 70 years old, and I've been a Regenerative physician, but also a repeat Regenerative patient to keep me going. And that's really what's helped me stay active and enjoy life. And I work with my associates, Dr. Alsheimer and Dr. Sally. We are board certified in our specialty of physical medicine rehabilitation, and we are specialists in interventional orthopedics, which I'll touch base on soon. We have 5 locations, one in Pittsburgh, which is our main location, in RIDC Park. We're also in Monroeville, Bridgeville, Washington, and Sewickley. We've been part of the Regenerative network since 2012. We've done over 2,500 stem cell procedures and approximately 10,000 platelet-rich plasma procedures. And it's important to note that you get us as board certified physicians. You don't get any physician extenders, nurse practitioners, PAs. We treat you from beginning to end. So why are you here? Why am I here? Well, we fill in a continuum of treatment, which is pharmaceuticals, steroid injections, which is standard care, physical therapy and chiropractics, and surgery. And most people are looking for an alternative to surgery. They haven't gotten better with the traditional treatment, and that's where Regenerative fits in. And the evidence for orthopedic surgery being effective is very poor. About 20% of the studies that are out there are randomized placebo-controlled studies that show orthopedic surgery to be effective. And interestingly, the most effective treatment is in carpal tunnel syndrome. A lot of the surgeries are ineffective, and if you or on Google, on my Google feed today from the University of Sydney in Australia, they talked about how the 3 orthopedic surgeries were harmful to you in your pocketbook. And they talked about lumbar spinal fusions, arthroscopic surgery of your shoulders and your knees. They did not find these surgeries to be effective. And though there are hundreds of thousands of surgeries performed every year, in fact, over 1 million surgeries, it's important to note that the risks of these surgeries are significant in terms of having heart attacks, strokes, complications, including nerve damage, infections, blood clots, and even death. The other thing, and this is fairly classic arthroscopic surgery, which is to remove meniscus from the knee, has been found to actually speed up the demise of the knee, leading to total knee arthroplasty. So what it does is it changes the biomechanical relationship of the knee so that the knee breaks down easier. So the bottom line here is let's stop cutting things out and inject biologic agents that can help build tissue up. So first, I want to talk about Regenerative, and then I'll talk about interventional orthopedics. So Regenix is a highly selective physician network. In fact, we used to have a slide that said it's harder to get into Regenix than to go to Harvard. We use proprietary high-dose protocols where we can concentrate your stem cells and your platelet-rich plasma to your specific needs much higher than the average practitioner, because we use a lab and not a bedside centrifuge. Regenix is the world leader in research and development. We're at the forefront of treating regenerative treatments. We've done more research, about 40% of the world's research on stem cells, for instance, and we change and develop our protocols as research dictates for us. We also now are starting a national self-funded employer practice so that some employees of certain industry can get their stem cell treatments at reduced cost. Now for interventional orthopedics, this is a less invasive new medical specialty. We're not using scalpels. We're delivering our orthobiologics by image-guided injection. And as a result, there's a much lower risk when compared to standard orthopedic surgery. And this is just an example of somebody who's had both knees treated, including anterior cruciate ligaments. And what you see is that the person has a Band-Aid. The procedure takes very little time. There's less downtime after the procedure, short rehab, much less in the way of drugs. Typically, people may need a couple medications to get them through the night, but that's about it. People are back to work in days, not weeks. And likewise, they're back to the activity that they love much more quickly. And for many of these procedures, patients are wide awake. It's not particularly painful. Numb up the skin, get the job done, get out, put a Band-Aid on, and people go home. We treat an awful lot of areas. We treat the spine, the hand, wrist, and elbow, the knee, the shoulder, the hip, the ankle, foot, fingers, toes, temporomandibular joints. We really can treat almost anything as it relates to arthritis, tendinitis, ligament problems, bone problems within the person's musculoskeletal system. So we're experts in all of these areas. What you can see here is that we have two things. One, that C at the end of the room is called a fluoroscope. It's an X-ray machine that tilts in space. And we also have an ultrasound machine right in front of it. And these are the image-guided treatments that we use to precisely treat people where they need it. And rather than have a bedside centrifuge, we have a laboratory so we can concentrate your platelets and stem cells to a much higher degree. And we find that this works much better for you. So for instance, if we're injecting inside a disc, our concentration of platelets is 20 times normal. If we're injecting inside a joint or ligament, we may use a concentration between 7 and 10 to 14 times normal. And these are much higher than your bedside centrifuge can get anywhere near. So I'm going to give you a couple examples of interventional orthopedics. The first one is treating anterior cruciate ligaments. We can treat anterior cruciate ligaments through a needle with either platelet-rich plasma or stem cells, depending upon the degree of separation pathology. If it's stretched, platelet-rich plasma will likely help. If it's torn up to 1 centimeter, stem cells likely are the answer. And here's an example of treating at the top. You can see treatment of a shoulder with the torn labrum, and through that same needle, we then treat the shoulder joint itself. Here, we're treating a bone marrow lesion where there is a cyst that's bright in the kneecap, and right below it, there's bone marrow edema suggesting that the patella has some microfractures, and so we're going to put some stem cells into that bone to heal it. And here, this is an example of what's called hydrodissection of the median nerve at the wrist, carpal tunnel syndrome. By injecting growth factor around the nerve, we can heal the nerve and also provide some space for the nerve to exist, and people get over their carpal tunnel syndrome without ever cutting them without surgery. Here's an example of a rotator cuff tear on the left that's filled in with stem cells, and after several months on the right-hand side, you can see the same area has been filled in. And this is Julie. She's one of our Regenerative patients. Julie was on crutches for a period of 3 years. She had a hole in her knee as a result of a dead bone. She couldn't bear weight on it. We filled it in, and about 6 months later, she could walk, she could get rid of her crutches. There's still what appears to be a small hole, much smaller, but the surrounding area has healed up and her pain went away. So we're going to talk about platelet-rich plasma and stem cells. Platelet-rich plasma has growth factors and other things within it that amplify healing. PRP acts like an espresso shot for local repair. It speeds things up and makes the platelets in the area work harder and work longer to enhance the healing process. Stem cells act as general contractors for a repair job. They orchestrate the repair. They tell other cells what to do and how to repair the damage. They also work very effectively and together with platelet-rich plasma, and they can act as cells, and when you place them on certain tissues such as tendons, ligaments, cartilage, and bone, they become those cells. So they can directly repair that tissue as well. So we use your own cells. We're not taking cells from babies or getting them from pharmaceutical representatives. These are your cells. We harvest them from you. We concentrate them and use them. And again, they can help pretty much anything in the musculoskeletal system, from tendon, ligament, a bone, a joint, and nerves. PRP, for example, is drawn from the blood. Stem cells we'll talk about further. We take this from your posterior pelvic bone and concentrate it in our lab. So not everybody needs stem cells. Many people can get away with platelet-rich plasma, and what we do is make sure that we have the right concentration, the dose, and the viability to get the job done. In our practice, about 50% of the patients we see get PRP injections. So what can't it help? Square pegs in round holes. If your arm bone or your hip bone have degenerated so significantly that the bone has collapsed significantly, we can't repair this. It needs joint replacement. People who have active cancer, for instance, not great candidates. People who have elderly who have very limited hip mobility, also not great candidates. But most other people we can treat and treat quite effectively, including people who have been told that they need a knee joint replacement. About 87% of those patients do well with the Regenerative treatment, which includes stem cell treatment from you. You're using your stem cells, and that this works about 87% of the time in preventing you from having a joint replacement. In general, PRP is for smaller joints, less severity, ligaments, tendons, and we use it extensively for spine to treat ligaments in the spine, treat facet joints, treat discs if necessary, though we can treat discs with platelet-rich plasma and or stem cells, and we treat spinal nerves. Bone marrow concentrate stem cells for larger joints that have more damage, more severity, and lesions in bones that I showed you with Julie. Again, 50% of what we do is platelet-rich plasma, 50% are stem cells, which include platelet-rich plasma. The platelet-rich plasma is significantly less cost, and as we say, not everybody needs stem cells. So the pre-injection in terms of stem cell treatment, I just saw a farmer today. I was pleased to use this analogy. The first step is tilling the soil. We inject a dextrose solution into the joint and around the ligaments to stimulate inflammation and rally your immune system to get you ready for stem cells. The heightened immune response enables the stem cells to function much better. Second step, we harvest bone marrow from your posterior pelvic bone, and that's the source of your stem cells. We usually take cells from both sides, and we take them to our lab, concentrate them, and re-inject them that same day. Second stem cell injection, we say, is planting the stem cell seeds. Typically, it occurs 2 to 4 days following the pre-injection. Again, we aspirate your bone marrow. The aspiration is not particularly painful, and we can use laughing gas nitrous oxide sedation so that it's really essentially non-painful at all. We take it to the lab and re-inject about 2 hours later. And then the third treatment is usually 2 to 4 days after the second treatment. This is where we are fertilizing the seeds, putting more platelet-rich plasma on the stem cells to jazz them and get them to work harder. It involves a blood draw, lab process, and re-injection. The re-injection generally is short, anywhere from 5 to about 20 minutes. And the lab processing takes approximately 1 hour. Regenerative has done most of the research on stem cells. There are 29 peer-reviewed published papers. We have a registry of 34,000 patients. Regenerative has about 70 locations nationwide and about 10 outside the country. And we keep a registry on all the patients we treat, so we know what works, what doesn't work, how people are doing, whether there are problems that need to be addressed, et cetera. Clinically, there's ongoing research. We have randomized controlled studies. There are 3 in the pipeline right now. And we change our protocols based upon research outcomes. So things do change over the course of time as a result of the research that's being done. We have the world's largest safety paper. Over 2,300 people were studied. We found the Regenerative treatments to be incredibly safe. The most common problem was pain, which is minimal, typically less than a day in a joint that we inject, typically in the posterior pelvic region, less than 3 hours. Compared to orthopedics, we're orthopedic surgery is about 6 times more dangerous than a comparable Regenix procedure, because we use needles and they use scalpels, saws, and drills. So what I'm trying to get at is stacking the deck in your favor. You get the best doctors. You don't get physician fillers like nurse practitioners or physician's assistants. You get image-guided treatment. We have the research and safety to prove our effectiveness. And this is personalized medicine. This is not one size fits all. We look at your cell, we look at you and decide what is right for you. So whether it's high concentration or low concentration, platelet-rich plasma, or a combination of both, or stem cells at platelet-rich plasma will be decided once we evaluate you. And we do evaluate you. We extensively evaluate you and determine whether you're a candidate. We're transparent about everything that we do, including whether you're going to be an effective candidate, and also the cost that you will incur. So who is this for? It's for you and me. It's for people who want to avoid surgery. You want to keep all your body parts. You don't want to have them removed. You don't have time for downtime or lengthy rehab. You don't want drugs, or you want to get off your drugs. You've failed surgery before. And we have younger athletes that are too young for surgery, and they want to undergo treatment. And you're getting your life back. You're increasing your participation with your family. You're enjoying your life again. You're back to your livelihood. You're restoring your fitness, and you're restoring your relationship with your loved one, your children. The results generally are a good outcome. You're going to have less pain to no pain. Your function is going to be increased as a result. Your mood will be improved. We're going to get you to be off most of your medication or all of your medication, and we're getting you back to your preferred active lifestyle. Life is for enjoyment. We might as well get you there. So the next step, there's really no referral necessary. You gather your x-rays or MRI, you call our Regenix liaison, you go either to an appointment in person or a telemedicine appointment. We will prescribe imaging if you don't have this before the visit. If you're a candidate, you get treatment. If you're not a candidate, then we tell you that at the time we see you. You can rehab at home, or we like to prescribe a month of physical therapy, and we get you back to your enjoyable life. So you make an appointment with one of our 3 doctors. Importantly, the Interventional Orthobiologic Foundation, which is a research and educational arm of Regenix, has certified all of our doctors. We are master certified in every area that we treat. What does that mean? That means that we've been through basic courses out in Denver over a weekend. We've been through intermediate courses, and finally we've taken and been certified in all master level courses, whether it be elbow, wrist, hand, shoulder, knee, foot, or spine. We are experts. Each and every one of the doctors have had hundreds of hours of extensive training in addition to our residency program. So we're not weekend, we've not gone to a weekend course. We've gone to many courses over the course of the last 12 years, approximately 3 or 4 a year. And we have the certification to prove it. We're all specialists in interventional orthopedics, but our background is physical medicine rehabilitation, which is a specialty that's expert in musculoskeletal medicine. So we have the right training to do all of these procedures. We use imaging to do these procedures right. So the second step is to get an exam. You're going to have an extended exam with us. We spend about an hour with you, gathering history, performing a physical, reviewing your diagnostic studies, and then performing an ultrasound examination uh, uh, of your area in question. And we understand that just we're not the knee doctors or the shoulder doctors. Things are interdependent. So oftentimes, if you have a knee problem, you may have a spine problem, you may have a foot problem. We're going to address it and explain it to you. And then we'll answer all your questions in that appointment. And then get treatment. Again, treatment is very simple. It's pretty painless. There's little to no rehab, minimal to no pain meds. I've had this done to myself. I took 3 pain medicine pills the first night, and that was it. I wanted to sleep. I didn't want to read or watch movies all night. You're not going to really miss any work unless you're a heavy laborer. You can go back to work within a couple of days. And we're going to give you your life back, whether it be gardening or golfing or walking or bowling. I have an 85-year-old bowler. And we've treated people up to 98 years of age. So nobody is too old to undergo this treatment. So I want you to consider taking your health off hold today. You're going to avoid the surgery backlog and the worsening of your condition as time goes on. You're going to get your fitness back and your weight reduced because you're getting your fitness back. We're going to increase the quality of time with your loved ones and your peers. And no one's getting any younger, so why wait? I've had a couple of people who have had severe knee angulation problems where they've been a knock-kneed and they were at the edge of acceptability. When I saw them 6 months later, they were like the Leaning Tower of Pizza that had toppled to the point where I really couldn't help them. So don't wait. So insurance most often covers the consultation, the follow-ups, the diagnostics, the bracing, and the therapy. What insurance doesn't cover are the regenerative procedures, the prolotherapy, the platelet-rich plasma, the platelet lysate, and the stem cells. It's important to know that with copays and deductibles, some people are actually paying more for traditional orthopedic surgery than to undergo a self-pay regenerative procedure. Again, we're going to customize your treatment plan for you. So this comes in a wide and varied price range. So the next step is to schedule a patient exam. Again, you're going to see a physician for approximately 1 hour, and we'll go over everything to your satisfaction. So contact Sarah Ferland. She's our person who works in the Regenerative call center. You can reach her at 412-963-6480. So again, I want you to consider Regenix as your best alternative to avoiding surgery, reducing downtime, and getting your life back. So thank you very much. I'm going to try to answer questions. So I'm opening this for questions now. And I want you to, if you have questions, please type them in and I'll attempt to answer them. I do have a question from George. First, he says, I have degenerative disc disease and a bulging disc that's debilitating and incredibly painful. Can Regenix help with that in lieu of surgery? So the answer is yes. Degenerative disc disease can be helped by treating your ligaments and your facet joints with platelet-rich plasma and treating the nerves with something called platelet lysate. Platelet lysate is your platelets concentrated, frozen, ruptured, filtered, and it's pure immediate release growth factor. It's great for nerves. It's great for bulging discs. And the answer is yes, we help people avoid surgery day in and day out. Lumbar spine is something that we treat all of the time. His second question is if so, how does the injection work? I don't understand exactly what's happening chemically or biologically to restore the discs, etc. So this is a question that the platelet-rich plasma, again, they have growth factors and they attract other healing cells out of the bloodstream that repair damaged tissue. So they can help with the arthritis, they can help with lax ligaments, they can help with muscles that aren't working and get them back online. With respect to discs, intradiscal injections are somewhat different. And so if you inject stem cells within a disc, you can activate chondrocytes. The stem cells can become chondrocytes, and you can enhance the disc size, function, and reduce the pain the disc is generating. We don't inject discs most of the time. It's unnecessary. Lastly, why isn't Regenix reimbursed by Medicare or most private insurers? There are no great answers to this question. Medicare requires lots of literature that is double-blind, randomized, placebo-controlled studies. The best example I can think of is cardiac drug in the Framingham study, which was 161,000 patients to prove that something works. I think that they look at this. I think that they're looking at regenerative treatment. I think that that this is something that will be considered in the future, but exactly when that occurs, I don't know. So thanks for your question, George. Next, can you still get a knee replacement after regenerative treatment? So the answer is absolutely yes. Having stem cells to treat your knee that's degenerated when you've been told that you need a knee replacement doesn't interfere with your ability to get that knee replacement. Again, our literature shows that 87% of the people who have been told that they need a knee replacement don't need to undergo that treatment because the Regenix treatment works. How long will it work? Probably on average about 6 years, and you should get good relief. There are some people like myself who are sticklers about how well we do. I'm an athlete. I want my knee to function at a very high level. So I've had a couple platelet-rich plasma boosters to make the stem cells work harder. I like to travel with my knee percentage around 95%. Thanks for that question. Frank asks, is PRP good for neck arthritis? Yes, we do a lot of cervical treatment and it works very well. We inject the facet joints in the back of the neck. We inject the ligaments. If you have some pain in your arm or pain running down your neck or headaches, we may choose to do a epidural that's either along a nerve root sleeve or in the epidural space. These are done under X-ray guidance. All of the spinal treatments are done under X-ray guidance, and it works very well. So I think you have a good shot at doing quite well. So I see that there are other participants out there. I'm going to happily entertain more questions if you have any. I look forward to them. So I'll wait for a while. Again, it's been my pleasure to do this webinar. I apologize for the problems getting the slideshow going at first, but I think we got it. I think we got it solved. You're welcome to ask any questions of me, any questions of the procedures, if you have them. So I'll wait a couple minutes because I'd be happy to entertain those questions. I think it's interesting that the self-insured employer program seems to be going very well, and that employers, unlike the private insurers, recognize that the Regenerative procedures are a win-win-win for the employer. First, it costs them less in their overall insurance. Second, they get their employees back to work very quickly, much quicker than if they underwent surgery. And thirdly, because their employees are highly satisfied because they've not had to endure long periods of rehabilitation and long painful periods. So my sense in going back and attempting to answer George's question is that with these self-insured employers being satisfied that they go through the same brokers that private insurers go through, and it's only a matter of time before this is an accepted mode of treatment. There are lots of people doing this out there. That brings up another point, and that is there there are a lot of folks that were doing amniotic tissue, placental tissue, cord blood, Wharton's jelly, and adipose. And a lot of those people have gone away. And the reason being, first, most of them were physicians who were doing that. And secondly, none of those tissues, though they were claimed to have cells, did not have any cells. And that was proven by a number of independent labs. So the FDA really is finally cracking down on this. So that type of treatment is going away. The other treatment being obtaining what are called MSCs, or mesenchymal stem cells, from fat. We get our MSCs from bone marrow. MSCs from fat require washing the fat with an external substance called collagenase. And the FDA considers that to be making a drug. So at this point in time, that's illegal. Another question, I hear the natural biologic stuff on the radio. How is Regenerative different? So the QC Kinetics are an entity that has come to Pittsburgh, and they are new to this realm. They are using platelet-rich plasma and stem cells, but their providers are not generally physicians. They are physician's assistants. They may be nurse practitioners. The evaluation is done by a physician's assistant, not a physician. And their ability to concentrate their biologics differs from Regenerative. We have a lab, and they use a tableside centrifuge, so their ability to concentrate their biologics is much less. I can't vouch for image guidance. I don't believe they use fluoroscopy, X-ray guidance. They probably do use ultrasound guidance. But there really is no comparison when you compare our physicians to their physician extenders or our physicians to their physicians. We have much, much, much more highly specified skills and training. So they're blanketing the radio waves and doing these 1-minute ads that sound great, but beware. So I don't know any other entities that are out on the radio right now. We do a radio talk show on KDKA, and we do it once a month with Rob Pratt, and it's a show where we invite callers, et cetera. It's not an infomercial. So I think our next one is coming up April 20th at 7 p.m. on KDKA. That should be a Tuesday. It's either it's a Wednesday night. So any other questions, I'd be glad to entertain. I'm trying to think of things that I really haven't answered or talked about. Again, it's important to know that there is nobody that is too old for this treatment. Your stem cells are less plentiful, but they are viable. And so we can harvest enough cells to get a good result in a single joint. We see plenty of people over 80, some people over 90. We have not seen anybody over 100 years of age. Likewise, the young folks, we often see these injured athletes that have torn their menisci or torn their anterior cruciate ligament or strained or sprained a shoulder, an elbow, an Achilles tendon, and we treat these people all the time. So youngsters are no exception. I don't think we've seen anybody under the age of 12 or 14, but they heal up very, very well. So most of the people that we see have very good results and are quite satisfied with treatment. So any other questions, I'll be glad to answer. I see that there are still some folks that are hanging around and listening, and I'd be glad to entertain some more questions. Anybody else? Well, I hope you've been satisfied with the talk. I'd like to see you. Again, our consultation is paid for by your insurance company, and there's really no risk to you. And hopefully you'll get the answers and the treatment that you deserve without undergoing surgery. Thanks again for participating tonight. And I look forward to seeing you all in the future. So have a great night. Thanks again, and enjoy yourselves.